Good morning, Andrew. First of all, this is a big deal. How does the app work and what does it aim to do?
Good morning. It's great to be here and thank you for the opportunity. So just to sort of take you back to the beginning, where this originated from was two orthopedic surgeons at Charlotte McKay Joburg General Hospital, and they had started to use WhatsApp to coordinate care of patients, basically setting up groups, attaching clinicians to those groups and using that to facilitate the care or coordination of care of complex patients specifically. And the issue that they ran into was one of being compliant with healthcare privacy legislation. So what they were really looking for was a solution that was similar to WhatsApp, with all the benefits and the simplicity, etc., but really an app that they could use to coordinate and collaborate around the care of the patients. And that was really the genesis of Signapps.
All right, so how did the huge contract with Britain's National Health Service come about? Why did they feel that they urgently needed this? Because I believe that COVID-19 actually speeded up the process of them getting it in place and getting that contract done.
Yeah, that's a great point. I think, we've had quite a lot of success in South Africa in implementing the technology in COVID isolation wards. And I think one of the things that appealed to them about the application in this specific context was that it allowed a number of healthcare practitioners to actually participate in the care of patients, sharing information. Obviously, it's a new area. It's an area that clinicians are still building knowledge about. So that was the one aspect, the ability to actually get lots of brains on the problem. And then the other aspect of it was the fact that it's generally the older clinicians that have more experience, especially when you're dealing with an infectious disease that's complicated. It's to some extent it's unknown. How do you get some of the more older clinicians on the problem without actually having to necessarily expose them to the patients in isolation wards, because they are older and more vulnerable. So I think in the context of COVID, those are probably two features of the product that really appealed to the NHS and features of the product that we've used very successfully in South Africa, in state and in the private hospitals.
So the app did receive some funding from the Department of Trade and Industry, but has it been fully deployed in local state hospitals particularly?
Yeah, so I think first just to focus on the positive side of the story here, we were very, very grateful to government. They actually backed us in the very early stages of the development of this application. So we received funding from the Department of Trade and Industry through the SPI Innovation Fund and from the Gauteng Innovation Fund, which really helped us get the app off the ground. And I think really the inspiration or what the government saw was the potential to deploy this technology into state hospitals. It's very lightweight, it's very easy to use, it solves a very important problem in these environments. And they obviously saw the potential and backed us, and we're extremely grateful for the fact that they did. Since then, we have done a lot of work in state. We've implemented in Barra, Red Cross Children's Hospital, Charlotte McKay, a number of other hospitals, state hospitals around the country. But my feeling is, we could really scale this application to be much broader, in some ways similar to what we're now doing with the NHS. There's a huge need for this application, or this type of application, especially given the shortage of healthcare workers in South Africa. There's a need to address this COVID problem, specifically using it in isolation wards. So, we'd love the opportunity to engage a little bit more deeply with the National Department of Health around this. It hasn't been, to be honest, it hasn't been that easy to actually make contact with them. We'd welcome any opportunity to actually engage with the National Department of Health to look at how we could actually scale this into all of the state hospitals if possible.
All right, and then any luck in terms of the private health sector, maybe trying to get the app to be used there?
Yeah, so we've had considerable success in the private healthcare sector in South Africa. It's been adopted by a number of hospital groups, both independent and the larger hospital groups. So as an example, we do a lot of work with Life Healthcare, assisting stroke patients through that acute phase of care and through a rehabilitation process. We're also working with administrators of medical aid schemes who play a very important role in the ecosystem. we've had considerable success in the private sector in South Africa. And I think one of the reasons that we actually pivoted into that space is it was a lot easier for us to actually commercialize our technology with private hospitals. But as I said, we'd love to be doing a lot more in state. We see a real need. There's a lack of digital infrastructure in those environments. And we feel like the app has an important role to play, especially since the government actually backed and invested in it in the first instance.
All right. Thank you, Andrew. We'll leave it there. Signapps CEO Andrew Davies.